Hi, my name is Caleb Perkins. I'm going to be doing my piggyback and my med push video today. First thing I do, wash my hands. This is the same patient that I put the IV in, so then I would assess the IV site for any sort of infiltration, complication, swelling. My hands are washed. I would get my 11 rights, 3 checks, general principle safety practices, 2 patient identifiers. And of course, my hands are washed. I would then apply my gloves. All my supplies have already been gathered. First thing I'm going to do is my med push. Picking the port closest to my patient, I would grab an alcohol prep pad. I would wipe off my port. First would flush normal saline. Here we go. I would flush this at a semi-slow pace, just flushing the whatever would be in here out of here to where it's just saline. Pop this off after I flush. Wipe this off, scrubbing the hub 30 seconds. Next one will be my medication. For this one, administer slow, about a minute of the entire push. And after I have pushed all that, take this off, scrub my hub one more time. I will then take my final flush, and since there's still medication in the IV, I'll need to flush this at the same rate that I flushed my medication for. So slowly, 1 minute we'll say, and then take this off. Scrub my hub, and then I will grab my Kuros cap, or disinfectant cap, whatever you want to call it. Put that on, and now I'm ready to gather my piggyback supplies. So I have my secondary tubing. Here we go. We'll say this cap was on here when I grabbed it, but maintaining aseptic technique, I would not let any of this touch anything to make sure this remains sterile. First thing I do, pop the cap off of my piggyback bag, pop the cap off of my spike for my secondary tubing. Really get that in there. Then I'm going to demonstrate that there is fluid coming through here. So then I will take my cap off, maintaining aseptic technique, and show that fluid can freely come through. Grab my cap, put my cap back on. I will slide my cap into here while I get my other bag ready. So since that is a medication and this is saline, I'm going to want the medication to be pumping the fastest. So then I would want my bag to be lower. So I would hang my bag down here of normal saline. Then I would grab my piggyback bag. Here we are. Grab my piggyback bag and hang it up here. Maintaining aseptic technique. Make sure my bolus right here is filled up all the way. So then I would grab my port right here. I would grab my port, and then I would scrub my hub. Take my cap off, and I would attach, maintaining aseptic technique, attach it to my primary tubing. There we go. Now since this one sets higher, this one will be empty first. So then I would monitor my patient the entire time that these medications have been administered, as well as when I pushed medicines through the syringes, I would have monitored my patient's response and notified anybody immediately. And now that my bag is done, we'll say it took 30 minutes to do. Now that I would come back after said 30 minutes, and then I'd get ready to take my bag off. I would come down here, grab my port, unscrew my port, pop it off. I would wipe this clean, scrubbing the hub for 30 seconds at least. Keep this open one away. This would already be empty. So then I would grab this, my piggyback should be empty. And we'll dispose of this properly. I would hang this back up to its original position. Wash my hands after I take my gloves off. Document the medication was administered. Document my patient's response. And that's about it. Thank you.